Welcome to This Explainer. Let's just jump right in because we have a truly fascinating topic today. When you think about stomach cancer, you'd naturally expect the warning signs to be, well, in your stomach, right? But what if the very first clues actually showed up on your fingertips, your skin, or even in your nerves? Today, we are looking at 20 completely surprising signs of stomach cancer that manifest outside the stomach. You know how the famous detective Sherlock Holmes could track down a criminal from just a single tiny thread left at a crime scene? Well, in this explainer, we're going to learn how to become the Sherlock Holmes of our own bodies. We'll find out how interpreting the smallest, seemingly unrelated clues can help us spot danger early and potentially save our own lives or the lives of the people we love.
This quote right here brilliantly captures the whole essence of what we're looking at today. You see, a gastrointestinal disease often drops its first hints far, far away from the stomach itself. In the medical world, a lot of these are called paraneoplastic syndromes. Essentially, this means the hidden cancer is pumping out hormones or triggering an immune response that creates some truly bizarre symptoms in entirely different parts of your body. They act like early warning bells, and if you know how to listen for them, you can catch the disease before it progresses too far.
Now, don't worry if 20 different signs sounds a bit overwhelming. To make sense of it all, we're going to break this down into a logical, easy-to-follow body scan. We'll cover clues on the skin, clues in the blood, clues in the nerves, signs of metastasis, and finally, how to use all this for early detection.
So let's kick things off with Section 1, Clues on the Skin, looking at external anomalies and warning signs.
Dermatology is an incredibly visual field, and spotting clues often comes down to a doctor's keen clinical sense. Honestly, a single glance from an experienced specialist can sometimes unravel a massive internal mystery. Look, as we age, it is perfectly normal to get a few age spots or warts. Having 1 to 5 of them is just a standard part of life. But if you experience a sudden, rapid explosion of itchy, dark warts, especially localized on your chest and back, over the span of just a year or two, that is a massive red flag. This is known as the Leser-Trellat sign. It is strongly linked to gastrointestinal malignancies. Basically, the cancer is releasing hormone-like substances that act directly on your skin, causing this sudden breakout. If this happens, getting a stomach camera and endoscopy is absolutely crucial. Moving down to our extremities, here are 3 incredible clues that can actually show up right on our hands and feet. First is Basic syndrome, which is where the skin and nails become abnormally thick because of growth factors secreted by a tumor. Next, we have clubbed fingers. This is where the fingertips actually swell up into a drumstick shape. Believe it or not, Hippocrates first documented this way back in 460 BC. It's caused by the tumor overproducing a vascular growth hormone called VEGF. Finally, we have tripe palms. This one is wild. The skin on the palms and soles thickens with deep ridges, literally mimicking the inside of a cow's stomach. The absolute critical point to remember here is that tripe palms have a 90% link to cancer. Now, if the underlying cancer is treated, these skin conditions often disappear, but they can come right back if the cancer relapses. And the sheer variety of these skin clues is honestly staggering. Take paraneoplastic pemphigus, for example, which causes severe, really painful red blisters because your own immune system is overreacting to the cancer. Then there's acquired ichthyosis, which can turn an adult's skin into fish-like scales. Dermatomyositis presents as a V-neck shawl sign, basically a red rash wrapped around the chest, back, and eyes, paired with severe muscle pain. And perhaps most frustratingly, paraneoplastic urticaria. These are chronic hives that flare up at night and completely ignore standard allergy antihistamines. If an adult suddenly develops these stubborn, unexplainable skin issues, they really shouldn't just settle for dermatologist scream. A thorough stomach camera check is definitely in order. Which brings us to another major warning sign. Acanthosis nigricans. You'll recognize this as thickened, velvety skin with dark pigmentation, usually showing up in the body's folds, like the back of the neck, the armpits, or the groin. What's absolutely fascinating, and quite terrifying to be honest, is that this velvety skin often appears right alongside the tripe palms we just talked about. When a patient has both of these specific skin conditions at the same time, stomach cancer is the most frequently diagnosed culprit. All right, moving on to Section 2, Clues in the Blood. We're looking at invisible chemical imbalances. Let's shift our investigation inward. While skin signs are right there, visible to the naked eye, stomach tumors can also act like rogue factories, inappropriately secreting hormones that totally scramble our internal blood chemistry. Take SIDH, for example. The stomach tumor illegally produces an antidiuretic hormone, forcing the body to retain way too much water. This dilutes the sodium in your blood, which can lead to confusion, seizures, or even a coma. Or look at hypercalcemia. The tumor releases a hormone that spikes your blood calcium levels, causing extreme thirst and a sudden lack of focus. We also see the tumor completely hijack the immune system with things like eosinophilia and leukemoid reactions. This is where the tumor actually tricks your bone marrow into pumping out a massive, abnormal spike in white blood cells, sometimes rocketing all the way up to 50,000. These are essentially invisible chemical fires started by a hidden stomach tumor. Now, this next one is a particularly dangerous blood clue, Trousseau syndrome. Stomach cancer cells can release a sticky substance called mucin, which activates your platelets and clotting factors. This makes the blood dangerously thick and incredibly prone to clotting. The key takeaway here is that if someone is suffering from unexplained vein inflammation in their legs, or even worse, if they suffer multiple recurring strokes in a really short amount of time, the root cause might not be a heart or brain issue at all. It could actually originate from a hidden stomach tumor that's thickening their blood.
And that brings us to a really shocking number, 30 to 50%. That is the mortality rate for a terrifying condition called DIC, or disseminated intravascular coagulation. It's actually the #1 sign mentioned in our source material. DIC is this bizarre, paradoxical medical emergency. The stomach cancer causes the blood to clot simultaneously all over the entire body, which completely uses up the body's clotting factors. Because those clotting materials are totally exhausted, the patient then begins to bleed uncontrollably, from their gums into their skin and from their internal organs. It is a fatal emergency, and tragically, it's sometimes the very first sign a doctor sees of underlying stomach cancer.
Next up is Section 3, Clues in the Nerves, focusing on neurological system failures. Sometimes our body's immune system mounts a defense to fight the cancer, but accidentally triggers friendly fire, attacking its own muscles and nervous system instead. These paraneoplastic neurological syndromes often start from the bottom up. Patients might experience a sudden strange weakness in their legs, finding it incredibly difficult to do something as simple as standing up from a chair, a condition linked to Lambert-Eaton myasthenic syndrome. They might feel numbness, shooting needle-like pain in their feet, or suffer from severe dizziness due to cerebellar degeneration. Naturally, patients will visit neurologists or try nerve block injections, usually with zero success. But here is the absolute most vital piece of information. These neurological symptoms can appear up to 5 months before a stomach tumor is officially found. That is a massive, life-saving window for early diagnosis, provided the doctor knows to look at the stomach. This leads us to Section 4, Signs of Metastasis, where we discover physical nodes. These are the late-stage clues, which tell us that the stomach cancer has already physically spread to other parts of the body. Obviously, this is later in the game, but recognizing these physical nodes is still incredibly important. In about 2% of stomach cancer cases, the cancer metastasizes to the skin itself, presenting as hard physical nodules. And a massive 57% of these skin metastases appear right on the chest and abdominal wall. So often, these red nodules are mistakenly treated as simple bacterial infections, but when the antibiotics inevitably fail and a doctor finally takes a biopsy, they discover stomach cancer cells hiding right there in the skin. Building on those physical signs, here are 3 key metastatic nodes you can actually check for yourself. First is the Sister Mary Joseph nodule, named after the very observant nurse who first noticed it. This is a hard cancerous mass that forms directly inside the belly button. Next is Virchow's node, a historically significant sign documented back in 1848, which presents as a hard, palpable lump right on the left collarbone. Finally, we have bone metastasis, where the cancer invades the bone marrow, causing severe anemia and bleeding issues. By simply knowing to check your belly button and your left collarbone, you are instantly empowered to spot these critical lumps. Finally, Section 5, Early Detection Saves Lives. Let's talk about taking action on these clues. I know we've covered some pretty intense and maybe even scary ground today, but let's frame our conclusion around hope. These signs, whether they pop up on your skin, in your blood, or affect your nerves, aren't necessarily an immediate death sentence. They are a window of opportunity to intervene. So what is the action plan for our medical detectives? Step 1. Monitor your body. Look for sudden itchy warts, new ridges on your palms, or unexplained weakness in your legs. Step 2. Consult a specialist with excellent clinical sense, someone who really listens to your whole story. And Step 3. The absolute most important takeaway today. Get an endoscopy. A stomach camera is the ultimate diagnostic tool. When your body presents a confusing mystery on the outside, the answer is very, very often waiting to be found on the inside. So, I want to leave you with this final, provocative thought. Our bodies are incredibly smart. They try to warn us when something goes wrong, often long before the main event actually happens. If your skin, your blood, or your nerves started leaving clues today, would you know how to read them before it's too late? Well, now that you've watched this explainer, you are officially equipped to be the Sherlock Holmes of your own health. Stay vigilant, listen to what your body is telling you, and whatever you do, don't ignore the clues.